morning, everyone. It's always a pleasure and an honor to be part of a fraternity to discuss healthcare and digital healthcare, something which is very close to me personally. And in the current, I would say, scenario of things as we see from a geopolitical situation, I think it's really going to be one of the key drivers which is going to change not only the face of humanity, but also the way we look at, I would say, going across business and looking at our country as well. So we have a very distinguished panel with me, and I'm really honored to be doing the job of being moderator today. So what I'll do is, like overhead, we'll be doing a very quick round of introduction. Some of them may not need that, I would say, round of introduction because they are well known, but just still to so that we get it rolling. So on my left, I'll start with Dr. Prabhakaran Dorairaj. So he's a distinguished professor of public health and director, Center of Digital Health at PHFI. He's an eminent cardiologist and academician of global right. Who has moved from the commitment word of clinical cardiology to advanced science. And literally the way that he is working and some of the things that he's basically working on, it will be really an honor to be hearing from him of how he is looking at being the bridge from a clinical care to looking at from a digital health. Welcome, sir.
Thank you.
On my left, extreme left, is Mr. Rajdeep Ghosh, who is the Chief Product and Technology Officer, Digital Health at Dr. Reddy's and Svaas Wellness. So as goes by his LinkedIn profile, he is an intrapreneur and a biz transformation pace setter. So with successful track record of spearheading digital transformation, innovations, new product development, digital innovation in pharma, healthcare, medical devices, and high-tech domains. Literally a path setter in terms of the way he is looking at, I would say, getting some of these transformation. So we'll be honored to hear from him some of his experiences. On my right, we have Mr. Sudhanshu Mittal, who is the head of COE, Gurugram, and director, Tech Solution, NASSCOM, COE, focusing on IoT, AI, among a host of things. He is responsible for driving the solutions of which is some of the problem statements that get, I would say, brought up by the COE partners. He mentors startups, innovations on product development, finalizing solutions, intellectual property, and business strategy. A stalwart in this industry, and we'll be really honored to hear from him on his experiences. On my extreme right, Dr. Vasanth Venugopal, who is as he goes like a certified radiologist with over 15 years of clinical experiences, and an extinguished I would say, faculty at Maulana Azad Medical College. Being the CMO at the current organization, CARPLl, so he's basically, as he goes, the unifying force between what he calls as the clinical and the digital side of things. So it will be very interesting to hear from him how is he looking to be that unifying force. So as we get started, some of the key things that the previous panel spoke about. So when you look at healthcare today, and if you take the Indian context, is basically we are trying to, and all the things that we spoke about, like the present, I think the government is doing a stupendous job, and what the previous panel spoke about is basically going to address the two A's, as we say, which is making healthcare affordable and accessible. And if you look at the Indian context, that are basically two of the key things that we are looking to solve. And digital health and the products and the solutions and the entire ecosystem is looking towards building that. So whatever we are going to be talking today, whatever we are going to be basically discussing is centered around that. And I think that's something which is just to set the I would say, the context in motion, as we say. That would be some of the themes. And I will basically then look at some of the panel members to react to it. So starting with Dr. Prabhakaran. So as you see, like with your rich clinical experience and all the domain expertise that you get in, how do you think the entire, with clinical being at the core of it, how do you think digital is being the game changer? And what, according to you, with your experience and that you are seeing both in India as well as outside, how are some of these products literally being the game changer? So if you can just maybe shed some light, that would be good to start with. Thank you.
Thank you, and good morning to everyone. I, I think just stepping a little bit back, digital health encompasses a broad swathe of solutions, starting from frugal technologies to very high-end technologies. So in terms of clinical issues, digital health, I think, will have a major role to play as we move forward. Given the fact that chronic diseases are almost two-thirds of the problem in the country, in fact, two-thirds of the deaths are related to chronic diseases, we require to redesign the health system in such a way that we have a solution which addresses the shortage of doctors, specialists, nurses, and other healthcare providers in the country. And clearly, you don't really require every patient to come to the clinic, spend a lot of time. If I have to just take through a journey of let's say, a patient with heart disease. I mean, I'm a cardiologist, so I can speak in relation to that. If a patient comes with hypertension and diabetes to a clinic, patient is diagnosed and investigation is ordered, patient comes back again, and then sometimes a specialist care is required and the patient is referred. So it all takes actually 2 to 3 days. And digital health can provide solutions in terms of reducing the time, actually can provide a one-stop solution. So clearly what we need to think of is not either or, but encompassing multiple things together. So I think instead of calling it digital, there's a new terminology which people use called phygital, physical plus digital. The first encounter could be physical, and after that it could be digital, because patients really do not need to come back to the hospital again and again for refill of medicines, for, to see the doctor just in terms of taking advice and so on. So there is a huge scope in terms of reducing the time for the patients in the hospital, and it's also environmentally friendly. In fact, in COP26 and 27, one of the solutions for climate change has been telemedicine, and people have suggested that because the amount of travel that's required is cut down, and also there are a lot of other things which healthcare can become climate smart and climate resilient, and that includes digital health. So therefore, clearly there's a huge scope for digital health in terms of clinical care. Apart from that, digital health also can improve the quality of care by incorporating decision support systems and providing personalized management plan to the doctors in terms of the patient's inputs, which can be collected by a low level of healthcare provider like a community healthcare worker. I'll stop here and come back again if there's a follow-up question later.
No, thanks, and in fact, it's a very nice term that you coined, which is like the free digital, as we say, because end of the day, you don't want digital to be basically, because you are at the heart of providing care. So whatever we do in digital has to have that patient connect. Still, the doctors are the people who will be delivering that claim. So basically, how it enables. So Rajdeep, moving on to you. So it's a very interesting journey, like for an esteemed organization like DRL. And in fact, like a few of us in the room would have, I'm sure everyone would have heard about it. So how has been the journey that you as an organization and then you personally have taken of basically being that, transforming it to be a digital entity, working with some of the leading, I would say, tech solution providers, the startups. If you can share some of this, I'm sure that would be interesting to hear.
Thanks, Sayantan, and good morning to all. So, healthcare as a whole, you just think of India as a country, and we are a country of 1.4 billion people, and that itself talks about gaps, challenges, and also a big set of opportunities. And we as an organization, Dr. Reddy, truly believe that when you talk about solving this challenge in healthcare, no one player can solve. No one player can come in and solve all these issues. It's a very complex value chain, and it has to be always an ecosystem of established industry players, government, and even startups working together to solve this set of complex challenges. From that perspective, that's also evident because today we still don't see an Amazon in healthcare, right, which brings all solutions in a single or maybe multiple apps or whatever, and one company can't solve. And that's what we as an organization thought, we are an established brand as a pharma. When you look at pharmaceutical and life sciences, we are the top-notch globally in terms of making even therapies affordable for countries like India and across various other countries across the globe. But then we also thought, are we doing enough? And this is applicable for every player in in this healthcare value chain, whether it's hospitals, whether it's government, whether it's even players like us, life sciences or pharma companies. And I'll just give an example. We are one of the top, players in oncology, in generic oncology in India, and also top in various other countries globally. Now, are we doing enough for the cancer patients? I will say yes, but on the other side, I'll say no. Because if you look at the unmet needs of a cancer patient, it's just not the chemotherapy, the product which we offer. It's also about side effect management, it's also about care collaboration, it's also about, nutrition, it's also about adherence, it's also about emotional counseling. Now, this is what we also thought, as an organization, I think we need to go beyond the pill. We need to go pill plus as a strategy. And we started investing on our digital efforts to, bring in solutions and services to go beyond and solve these unmet needs around this therapy area. Another big area where we saw as a huge opportunity and a big, gap in India. We all know that, most of you in this room are, I'm sure you all have health insurance, right? And health insurance today covers primarily your inpatient cost. But what about your outpatient cost? Now, your 70% of your lifetime cost in healthcare will be outpatient cost. And you also, we talk about digital in outpatient care, but then is digital like e-com? I don't think so, because it's not about listing of 10,000 doctors. I've come across startups, companies who says, I have 10,000 doctors listed on my portal. You select one and do your consultation. Is that good? No, I don't think so, because as an individual, I don't want to go for the cheapest doctor. I want to go to the best doctor. And that's not only me, that's the basically an aspiration of everyone in this country. And that's how we also, started working on an outpatient care platform where we are bringing together, I think already, the moderator mentioned, we are solving basically 3 big challenges. We are trying to improve the quality of care and access to this quality care in India. So we are trying to bring together doctors, just not from institutions, but also, private practicing doctors, because a lot of this outpatient care is delivered by them. So how we bring them and how we digitalize their practice, because until we don't digitalize the experience, you cannot deliver the right set of experience, can't compete with the institutions. The second is, again, how we also improve affordability. So we are also partnering with insurance players to ensure that, this cost towards outpatient care, how we can partner with them to also cover this cost for you. And third is, in future, we believe the care is more going to be, care paradigm is going to transform from a sickness to wellness. So it's not about you will go to a doctor whenever you are only sick, and that will in fact put a lot of burden on our healthcare system. Rather, it has to be also wellness which has to be driven. And that's where we're investing on digital therapeutics, condition management, and which is actually very similar to the capabilities which we have today. We have a very deep capabilities in terms of science, in terms of therapies, and that same capabilities, if we leverage on, digital health, I think we can do wonders. So this is what, in short, we are doing. Now, in all these, what I said, it cannot be done by us alone, and we also don't want to reinvent the wheel. So from that perspective, there is a big collaboration with the startup and academia which is happening. We are leveraging startups to, partner for EMRs. So we are equipping all these doctors whom we are onboarding as part of the healthcare ecosystem with electronic medical records. Number one, we are also, partnering with lot of, AI and data science-driven startups for coming up with solutions to leverage this data, come up with clinical decision support, come up with health risk scoring, health insights, and so on. And similarly, again, on DTX, on digital therapeutics and all, we are working with many. So I think that's been our journey. Very interesting for a pharma organization, because if you ask me, it is very anti to our basic DNA. So we were very happy selling pills all these years, but now today, with the changing era, and we also believe that our next growth, the next cycle of growth, which will be another $5 billion if you want to add to our revenue, that will not come from only pill, but that will come from all the digital health solutions which we are doing. So this is, in short, what we are doing today.
Well, thanks Rajdeep. And in fact, I'm just picking up some of the things which is like a pill plus, wellness. See, we have been hearing this, but if you were to really think that, I think the time has now come, and I think it's present. I'm not talking of future, where we are putting them into action. So being the trust that we have, so it is not just about, because there's always a suspicion that we have that, is it something only for commercial? So can it basically help bridge that trust angle? Because healthcare, as you correctly said, unlike an e-com, it's not, we can think it's commoditized, but it's still not. It's still a trust base. It still needs a doctor to providing that care. We are entrusting, and when you say health and life, it's basically we are entrusting him or her with that precious, I would say, thing that we are talking about. With that spirit, if I were to move to Vasanth and talk about it, like I think just maybe think that how are you as a clinician, as a radiologist, looking to basically look to bridge this gap? Because end of the day, as I said, digital is the means for to be delivering that care. So what according to you is going to be the key, I would say, things that are being done? And second is also, what are the things that when we look at this ecosystem being built, I'm sure there are so many of these cases, but how do we look at the key success ingredients in them, purely from a clinical point of view? So if you can share some of your thoughts, that would be
sure. Thank you, and good morning, everyone. So there are two parts to this question, and in fact two parts to this discussion topic. One is developing digital solutions and delivering them, right? So I think we understand very well what are the challenges in developing a digital solution, a robust solution, the access to the data, access to the tech, and so on. But nothing much is talked about the challenges in delivering the solutions to the clinics, right? I want to focus, at least in this round, so what are the challenges that we really face? So I'm a radiologist, and I'm sure every one of you or your family member would have had a scan in a hospital or a radiology center at some point of time, and we are the people who sit on the computer screens, read those images, 300, 400 sets of images, and make a report and sign out the report at the end of the day. And I'm sure you would also faced, the delay in getting the reports and maybe some kind of errors in those reports. Now, the new age digital health solutions, the AI solutions, which are based on this new revolutionary technology called deep learning, are available today. It's a very mature ecosystem, right? If you consider the digital health space, the radiology AI ecosystem is probably the most mature and well-regulated, and in fact, well-funded ecosystem there. There are close to 400, 500 maybe companies. They're growing, as we speak. Have built several solutions, and close to some 300 plus AI solutions have been approved by the FDA, the US FDA, for use in clinical settings. But you go to any hospital, not only in India, to any part of the world, and ask them which of these solutions are they using in their practice, not many is being used. So what's the problem there, right? So while we clearly understand the value of these solutions, they will help radiologists like us to make reports faster, read more accurately, and improve the outcomes of the patients. But there is not much adoption that has happened or even happening now. So the challenges, the three again, since we are talking about three challenges everywhere, I will also try to put the challenges in the buckets of three. The first one is the access. When I say access, it's the inverse access, right? I, being a radiologist, when I was reading scans, I wanted to get access to some of these solutions, regulatory approved solutions, to use in my practice. It's not possible, right? For a hospital in Uttar Pradesh to get access to a solution built in a small country in Lithuania, which is being talked about globally, to get access to that solution is not a simple task, right? It involves a lot of bureaucratic barrier to cross, and even to access. For the AI developer also, company building a solution in Bangalore, to get that delivered to a hospital or an imaging clinic in Australia is not easy. So that's the first piece of the problem. The second one is the trust issues, right? It was being talked about in the previous panel also. As a radiologist, for me to trust a solution with my report, which will directly impact the patient outcome, I should be definitely sure that whatever the digital health solution reads and gives us an output should be accurate, right? There is no margin of error there. The error in healthcare operates at the n of 0. We can't make any errors because it will directly impact the patient lives. So I need to be able to test these solutions on my data in a manner that doesn't consume my bandwidth, right? Already I have so many scans to read. Now for me to get using a solution, if I need to spend my time, too much time to assess these solutions, I'm not going to do that, right? To take time out. So there should be a simple way for me to build trust on that solution. The third most important problem is, how do I get this solution integrated into my workflow, right? So amazing solutions, 400, 500 solutions. My hospital works on a PAC system that we have been having for 10 years. Now, how do I get this solution integrated onto my PAC systems? That's the key piece, adoption piece, the integration challenges. Who do I talk to? How do I convince my IT team to get the solution onto my workflow? So these are the three challenges, which is what we are trying to address. We're taking a platform approach wherein we are on one side onboarding these robust regulatory approved solutions onto a single platform and going and integrating this platform with existing hospital IT infrastructure, and also providing simplistic tools for radiologists to assess and test them. So to answer your question, being a radiologist, and I understand the clinical workflow, and our organization, the CARPLl.ai, which was incubated inside a chain of imaging center called Margin Imaging, at our organization level, we understand the challenges of bringing these solutions into delivery mechanism and start using them. So we are building a platform to address those challenges.
Thanks, Vasanth. So with all the things that you mentioned, I'll just move to Sudhanshu, and with all his, I would say, experience of mentoring, be a coach to these multiple, I would say, startups and ecosystem. What is that you think is the reality right now in India in terms of how equipped, how developed they are? What do you think are some of the things that, because an ecosystem is always like a sum of all parts. So as you work with them, as you mentor them, what do you think is basically some of the things that they are grappling with? How are they basically, their business grounding? What's your take, and what is basically the ground situation? Because that's the most important thing that we would be interested in. Thank you.
Thank you very much. So I work with the startups in my current responsibilities day in, day out. Right? It's the primary responsibility that I have. And coming to the challenges that they face, or what we call the ground situation here, in many of the cases, or in a large number of cases, where I see that they have fantastic solution available, especially I'm talking right now about the healthcare sector only. While they have fantastic solutions available, which has been proven, they have done a lot of clinical trials, worked with the hospitals, and not just anybody, the hospitals of repute, and on their advisory body also, they have the known names from AIIMS and Safdarjung and the major private hospitals everywhere. The problem comes when they take those solutions to the market for adoption. And they have done the due diligence for getting the required certification also. Okay, I'm not talking about, let us see, certification, which is required for international sales, but then the required certification, the process, validation, everything for the sale in India. But then when they take it to the market, to the users, then they face strong resistance. And at times, you just cannot figure out. We run various programs to drive the adoption of solutions, especially in the healthcare sector, for our solution partners, innovators, whatever we call them. And the problem is that if I could figure out a problem, why is user not willing to move further with the adoption? I have a problem to which I can put my energy. The problem is that most of the time I don't even know what the problem is. It's like what is called unknown. It's not even known unknown or unknown known, whatever. That's the biggest challenge that you face. The private sector is, in a way, leading in this particular approach of adopting solutions, like Mr. Vasanth said earlier. But then when I use the word leading, it is still relative. Through our challenges and all, we get a lot of solution, the users who are interested in adoption. But then the actual adoptions are not even, I mean, of the order of some probably 1/3 of the total. They bring very interesting use cases. There is no doubt about that. But when we say that, okay, fine, now you have a right solution partner and let's move ahead with the adoption, that's when we start facing the problem. And as I said, in some cases we know the problem. It may be due to the internal integration issues with their hospital management system, which is third party, and then the third party is reluctant with the idea of allowing another startup to come and integrate their capabilities, AI capabilities with the platform. So that there it gets stuck. And this kind of problems are also there. But in many of the cases, it is just not there. And what I find, and perhaps any of the audience here, if there are knowledgeable persons, I will be very happy to be educated that these are the specific areas that I should try to address to be able to promote more adoption. What I have seen is possibly the person who is driving this digital activity in the hospital does not have the authority or does not have the internal stakeholders on board. In the previous session, I heard a problem area of technology use being complex. That is not always the case, because I'm talking about the solutions which are, in many of the cases, already adopted. It is being used in the market, which means it is validated by the user. And yet, we face problem when we try to take it to the more users. Because as a partially government-funded program, our mandate is to show impact on the ground. That's what we do. When it comes to the public health care, then the challenge is even bigger. And again, you get stuck in trying to figure out what particular area. I mean, for the public health care, we say that we will arrange the funding also. We take the solution and say that this is a simple healthcare solution, and we will arrange the funding. You just have to work with us for doing the adoption. And then it gets stuck there. It's like I am trying to sell something very large over there, for which obviously they have to generate money and do whatever. This is again the problem. And again, it's not 100%, but I see much more of that in the northern region of the country. I see more willingness for adoption when it comes to south, when it comes to the east. We have done deployments in Arunachal and Meghalaya and Coimbatore and Chennai. Multiple deployments actually there, and they are more receptive to the idea of using the digital technology there to, especially in the low resource area or the rural areas. But when it comes to the northern part or the central part, again, the problem is severe. Just not willing to move there. Now, I understand some of the problems as well. Unfortunately, the government structure, and perhaps somebody can correct me to that, I have been a private person, or corporate person all my life. The government structure is not really designed to take initiatives. If you take initiative, then obviously there is a possibility of failure. And even if you have not spent any resources of the government, you will still face hundreds of questions in case 5 out of 5 initiatives of yours, 2 fail, which is going to be the case. So that's why they are reluctant, that why should I put my comfortable job on the line here to do something new, where if I try to do something good and I face problems there. So it's definitely a problem. But then it's not, but then I think at many times, at least from my understanding, it's also the issue of why should I bother? I am doing this, that attitude, and then I don't know what else. So I'm willing to be educated on this as to how to track this particular piece of problem, on how we make impact on the ground through the use of data technology. There are solutions available, fantastic solutions, cost-effective solutions available in the market, which can cut down a lot of diagnosis requirements. And wherever we have done the adoption, the users have been extremely happy in all those cases. They are there on the ground. We say that anybody, please come to this place, see the actual adoption and what impact it is making. It's all there. But how to scale it up, how to drive more adoptions, that's a problem that I have been struggling with. And that's a question which I have here. If anybody can help me, I would love to interact with them more.
No, we can do that. In fact, it's like we can change the construct as well, and as Sudhanshu mentioned, also take a question on that, or I won't call it a question. It's basically can be a thought. But the key thing, I think what we all spoke about, in fact, if I were to talk about, is that end of the day we have to provide that what we call as a value-based care now, because it's not just about care, at an affordable, being accessible, and as we all mentioned, something which is then in a ecosystem based mode, because it cannot be one entity providing that care. And in fact, with the current ABDM, and that's something I think it's worth mentioning, the effort and the work and the vision, I would say. I think I'm sure that we will hear from Dr. Sharma when he speaks later in the day today. I think at least the vision that the government has, and I'm sure that we are moving towards that. Maybe late, that's all fine. But we realize that at least the vision and the things that has been worked on the scale, we need to also think about the scale of India, right? So with that thing in mind, in fact, so Dr. Prabhakaran, think about like from a care delivery in terms of value-based care, is there something that's maybe a point that comes to mind in Indian context, which is very important that we need to be keeping in mind? Because as then Rajdeep also mentioned, it's not a commodity. So how do we basically quantify and keep that value-based care, and being I would say a clinician and doctor? So what is that one mantra, if I can think about, that you would have for all of us?
I don't know about one mantra, but I think if basically what we are trying to do is redesign the health system. So as you rightly call it value-based care or good quality care, whatever we want to call. I think we need to answer 4 fundamental questions before we embark on anything. The first is there a clear-cut evidence that it works, that it intends to do what it does? I'm just taking the example of hypertension again, because I call it a disease of 3 paradoxes. It's very simple to treat, but detection rates are abysmal. Very good drugs are available, very good treatments are available, patients are not put on treatment. Even if you're put on treatment, compliance is poor, control is poor. In fact, if you look at the care cascade, ultimately when it comes to control level, it's just around 10%. So clearly, we need to address that question and see what is the evidence these digital solutions are giving in terms of enhancing that 10% to 30% or 40%. Second is, most people talk about it, is the financial feasibility, and we are talking of frugal technology, so it should be feasible. The third is the health system ready. Are doctors willing to use this? How do we make them use? Can we provide them a buddy or a partner like a nurse or a community health worker to help them, so that there is a system where there is task sharing rather than task shifting, and people can use these technologies and help reduce the time for the doctor so that the doctor can look at other things. So that's one area. Lastly, is it acceptable to the patient? We may talk about virtual technologies, but do people relate to that? And the biggest problem with technologies which are not being accepted is that it's a top-down approach. We gather a bunch of experts, create a solution, but we have not consulted the consumer at all. I mean, if you look at market practices, consumers are always consulted. Consumer survey or something like that is conducted before you introduce something into the market. But in digital health solutions, we have not done that. So now new concepts like co-creation and co-design of those interventions are happening. But we also need to look at the other challenges which are there. That includes the consumer level challenge in terms of literacy, digital literacy, doctors' digital literacy, regulatory issues, security, who owns the data, so on and so forth. And there are lots of other areas like technology, for example, interoperability. So how do we address these? So I think we as a group here, we are parts of the jigsaw puzzle. So all of us together can come up with a solution and create that solution ultimately. I mean, creating a white paper on how to implement itself will be a good process. Thank you.
I think that was helpful. Rajdeep, just quick thought, like as you look to do these alliances and partnership, what's maybe the most important thing that you keep in mind? Maybe there will be more. I'm sure that it's maybe difficult. I'm putting you in a spot to ask for one. But what is that one spark that you see when you talk about these things as you build your ecosystem that you were talking about? Maybe a quick thought on that.
So you are asking mainly from a partnership standpoint? Yeah. So one thing which I've seen is very different in healthcare when compared to any other segment is healthcare needs patience and persistence. Okay, I think that's what I believe is very important, and many of the challenges which we are talking about is basically due to this. Because healthcare, as I said, the trust factor is very important. So any startup who is coming here building a solution, even the doctor who is adopting it, they need to trust each other. Even the startup needs to build something not like a commodity, not like a typical e-commerce approach, but healthcare requires, even I'm just thinking, when you build a solution, are you taking an effort to also test the solution, publish a real world evidence study, instead of hurrying to just go and launch it? And that's what is the change, or that's a big thing which is important in healthcare. And when we also look at partnership, we look at these, and most of the time, it's also a problem because of the investors, the typical cycle of the investors where they need quick returns, and that doesn't work in healthcare. Healthcare, you need time to build that trust, you need time to build that quality. And no one in the world says that I can manage with this solution in healthcare, right? It's not, something like I buy and refund and then take another one. Healthcare, once an intervention is done, either it cures you or, it destroys you. So it's like that. So I think quality and trust is important. And that's what I again say, it's patience and persistence for anyone, whether it's a company like us who is investing on it. And similarly, it's also for all other players in this ecosystem.
And Vasanth, I think as you would have seen, like as you were mentioned, there are so many of these, maybe 400 plus some of these solutions. But what does it take for some of them to succeed? Or what is because I'm sure then in the audience, we might have some of these ecosystem players as well. According to you, what is that, maybe, I'm again putting in a spot, is that one or two thing that Rajdeep mentioned about that patients? Anything else from a clinical point of view that's absolutely important for them to be succeeding in this ecosystem play? I'm not talking individual play out here.
We operate in the enterprise, level, right? These solutions are not directly facing the patients or the consumers, not even facing it's facing the doctors, but the ultimate decision of paying for that solution or procuring the solution is made at the enterprise level. Now, as rightly pointed out by everyone here, there are three things which need to be there for a solution to succeed, and even in fact take the entire ecosystem to the next level. Is that the problem that they are trying to solve? The solution should start with the problem. We should start with the problem, not with the solution. That's very important, that you understand, go to a place, understand what are their pressing problems, right? If you've seen during the COVID time, every hospital moved to the telemedicine space. Before that, they were so reluctant to move because that was their pressing need. They adopted it. Every transformation happened very quickly. So you start with the problem. The next thing is proof points, right? You should establish proof points of value. If I am subscribing to the solution or buying the solution, number one, either it should increase my revenues if I'm a private player, or it should reduce my cost of operation. Right? That's the more key parameters that's been looked at the enterprise levels. Outcome is very important, but the problem for outcome is you need to be perseverant and patient to measure the outcomes in a long run. The outcomes of any digital health solution may not be visible immediately. It might need several years to follow through patiently and prove the outcome. So immediately, if you want, for any digital health solution, at least in our space, to be kind of successful, it needs to start with the problem and deliver value and prove that it's really valuable. It either reduces the cost of operation or increases the revenue. So whoever has cracked that is successful. Today, the most successful radiology AI solution will be the solutions which automatically detect fractures on X-rays, right? You go to any hospitals, the emergency department, the patient walks in, had an injury, gets an X-ray done. There is nobody to read those X-rays at that point of time. They have to wait to know if there is a fracture or not. So now these digital health solutions can automatically read those X-rays and immediately present those results that there is a bone that's broken, which can be attended to immediately. So that's the problem that's being solved. Right. I think.
No, thanks, Vasanth. And I think just the complementary question to you, Sudhanshu, is like you talked about from a clinical point of view, from business rounding point of view, with your experience, when you look at some of these digital health, I would say things. So what is maybe the one ingredient? And again, something I'm sure the audience would also love to hear, that one ingredient, which is the business rounding. What is that business rounding in an Indian context that is needed for them to be having a sustainable business model, for them to be succeed? Because you will have so many of these ideas, solutions that we have, but how do they really have a grounding in India which makes them prosper and flourish, and not just being an idea as a startup and ecosystem? And by your experience, what do you think about it?
So actually, when we say, so I will not use the word business rounding here per se. I will use the word the making them successful overall, because business is one part of the picture here. Your product has to be, as we have heard from everybody, The product has to be of a quality which will be acceptable to your end users, and it addresses the actual problem. I saw that in the beginning when I came to NASSCOM. In many of the cases, at least in the beginning, I saw that the startups or the players who were coming from the pure tech background, they had developed some fancy technological piece, and then it was not really mapping properly to the requirements of the end user. I still see that in many of the cases when I say that I have developed this particular piece and all, say that the technology part is fantastic, but then your mapping to the product is not, and maybe you should look at it in a different way. Sometimes they listen, mostly they don't, because they have their own strong thought process as well, which is fine. You have to have that. So that's one part of the picture, that how well your solution, whatever you are developing, and you have done the technical due diligence, so that is non-negotiable anyway. How well that actually addresses the problem or the pain point. Like I heard from one of the friends, that what is the life and death problem of your target audience that you are solving? If you do not have that answer, and it may not be really death problem per se, but then you have to be able to project that as the life and death problem which you are solving for your audience. It is absurd. The second part which comes is that, and there is for their success is that what kind of entry barrier you are able to establish in whatever you are doing. That once you go to the market, is it possible for somebody to come on with, let's say, more resources, and within 3 months or 6 months time replicate your solutions and take away your market? This is a very simple thing in this world, that what kind of entry barrier you are able to establish. And then, of course, do you really have what it takes to build your presence in the market? We talked about publication of how it is adding the database evidence publication as to how your solution is addressing the problem, making that public, building your brand presence there. There are all those multiple points, no rocket science into that. I believe that all the mentors that the startups work with, they should be able to give this kind of answers, nothing really specific. But as I said, that for me, the thing that I learned right in the beginning when I came to NASSCOM was that fantastic piece of technology, but then practically useless as a product. That's not the case all the time. I mean, the problem which I face is now deployment, because I know that the product is good. I know that this is going to solve the problem very well. It has done that, proved itself in different situations, and I want to scale it up as part of our charter. So that is a problem I have right now, but for the startups, it's a separate part.
Well, thanks, Sudhanshu. I think it's basically the harsh words of reality, and which is practical. Because at the end of the day, we have a care to be delivered, we have an idea to be sustained, but at the end of the day, it has to be basically then feasible as a business model to be rolled out. I think we have topped up the time, so I think we'll be happy to open the house for any questions. I might not even call it question, as Sudhanshu had mentioned, it can even be the ideas that we can think and discuss.
Advice to me or suggestions to me as to how that solves my problem.
We'll be, I think, happy to take that, and time permitting, maybe we can spend some time. Yeah, please, ma'am.
I have a couple of thoughts that I want to share. First, I will give my background, where from I come from. I have almost like 20 years of experience working with different projects of Ministry of Health and UNDP, but now I am with the healthcare consultancy, wherein I am heading the healthcare vertical and advocacy for corporates as well as non-corporates. And my question to you is, sir, now we have built the ecosystem, fantastic ecosystem of ABBA. But the question is that based on this ecosystem, there can be disparities. Like I have seen that a lot of consultants, a lot of new startups reach out to me with saying that their products are AI enabled. They are having the, RI systems in it and microscopy also in it. But then our guidelines are not framed that way. Our guidelines still talk about having a pathologist in the lab. So this is something when it comes to the cost cutting. So those kind of people, they want to have some kind of like hub and spoke model that the government can think of, wherein one pathologist sitting maybe at 10 PSCs or health and wellness centers, wherein they can just sort of upload their documents, and the person, doctor or pathologist at any that hub can look into other spokes. One question is that. Second question is how well we are connecting with associations. By that I mean to say, maybe gynecological associations, maybe nursing associations, even though we are coming up with ABBA ID, but health education is something wherein we have to reach out to the nooks and corners, if we have to reach the last mile and get everybody benefited, wherein we have the media dark areas, 102, 108 does not reach out to the pockets and all that. So in case we have to do the digital kind of interventions, I'm sharing some kind of their data points wherein Dindori in MP, अभी तक वहाँ पे कोई भी नहीं telephone चलता है. I have myself seen that you go into the deep PSCs or sub centers and all that. वहाँ पे 102 तक, even though you will ring, you won't get the van. So those kind of areas and pockets, how are we going to address those digital challenges still? For that matter. And second thing is, we are talking about the quality. So the trust itself, like of these kind of new innovations, new startups, I mean, it's not always, I have seen so many of our own friends, those who have been IITians, they have entered this segment. And now the Herculean task is government, they want them to listen, they want to be on these portals. So what is the SOP for that? How to make it more easier for those people who really want to, Bharat ka abhi Amrit Kal chal raha hai. So is Amrit Kal mein, Bharat at 100, if we have to envision that, Bharat at 100, what it should be. Coming to digital health, how successful we can be and what all steps we have to need and what SOPs we need to have to see Bharat at 100 completely digitalized. Thank you so much, sir. My question, I think that anyone can address. NASSCOM, Mr. Mittal can address my question, or anyone, that's fine. I'm okay with that.
I can pick a part of it. I heard a lot of questions into that, and I'm afraid I'm not really qualified or that smart to be able to answer all of them. I will just pick one part here. You gave a very specific case of pathology and the lack of pathologists. I will give a very straight answer to that, that there are solutions available in the market. Now, policy part, I will not go into that because maybe I will leave it to the government officials. There are solutions, and we have done the deployment of those with a leading pathology lab in the country for what is called smart microscope. And it solves exactly the problem which you mentioned, that the microscope can be deployed in the remote area where there is no trained pathologist. Into that, put the sample there, it will take high quality, very high quality picture, send it to their hub, and from there a pathologist sitting there can immediately take a look at that and make a suggestion to the person sitting at the spoke. This is one of the solutions. There are many other similar solutions which are available. They are there in the market. I don't know whether there is any policy intervention required for this particular activity. I don't think there is really, because while there is machine or AI or whatever part you call there in between, ultimately the report is going to be signed by a certified pathologist only. So I don't see any policy issue. It is simply, again, for those who are in this business to see that, yes, there is a value. This particular chain, they took one in the beginning when we took the solution to them about 1.5 years back. And now they are replacing in all their various, especially the remote labs, where there are no trained pathologists available. They said, that, yes, I want to put it there. They have bought something like 25, 30 different places. They have done the replacement already. So again, coming to this particular point, trust and everything, there are solutions available and which can address. Now coming to the other part of digitalization and other thing, I will leave it to others.
I just want to continue on that thread. I think you hit the nail on the head. The most important thing that we need to look at is multidisciplinarity. We are working in silos. So clearly you require, everybody needs to be part of the whole process. Just to give because you mentioned pathology, just to give a specific example, we worked with Google AI in terms of digital photography of oral lesions, the lesions in the mouth. And then we trained through deep machine learning in terms of identifying to say whether it's a cancer or a non-cancerous lesion. So the role of pathologist is actually, we are not excluding a pathologist here, but it reduces the role, because if the digital photography and the AI system can say, okay, this is cancerous, then the next level of going to the pathologist comes. So in the rural area and the PHC that you are saying, any community health worker with a little bit of education can be trained to do that photograph and upload it onto a system, and then that can go to the pathologist or whoever is reading it. I mean, the AI system can identify that it's a problem, and then the patient can be referred. So there are solutions, but the thing is, we have to look at it in a holistic manner rather than as digital health experts, rather than as entrepreneurs or startups. I think we require that multi-sectoral dialogue. Only then we can come up with a good solution.
Just to round it, maybe I'll not take too much time. And so what you mentioned about India at 75 to India at 100, this entire journey, which was started with an NDHM, what you would have heard about NDHM and the blueprint and all, I think it's a journey. We have to also think for a nation of 1.4 billion, as any of this journey is not easy. It's almost like one continent moving together. But if you see the four essential blocks, which is in terms of the identifiers, the registries, the interface, it's something which is journeying in the right direction. So I think it needs us to have the three things, which is what Rajdeep mentioned about that patience, which is a very key thing, the trust in what we're doing, and third is that interoperability, because we don't want something which works only in this construct only, and that's exactly what we are working. So I'm not, I'm not taking a side in terms of whether the government has done enough or not, but the direction and the vision is absolutely there, and that's exactly where we are heading. So I think that India at 100 is definitely a shared vision which we all have. Do we have time? Oh, we have run out of time. That's what. So maybe one. I know we have a lot of questions.
Yeah, I'll take this because I already have the mic with me.
Oh, yeah. That was unfair.
I am Dr. Parmeshwar, based out of Bangalore. I'm a practicing surgical gastroenterologist. Today's panel is developing digital solutions to deliver better clinical outcomes. Well, I totally agree with this when it comes to radiology or oncology at the at the level where we require an expert opinion, or where there are shortage of doctors, or where there is no access to get a proper diagnosis. But in the recent times, what I've noticed, especially after COVID, there are a lot of teleconsultations happening in the name of digital health, actually. That's not digital health. Somewhere as a policy, this is my straight, questions to Dr. Dorairaj Prabhakaran. He was mentioning that it is physical health plus digital health. One thing is very, very clear. In healthcare, you can never replace a doctor with digital health. This is the statement what I make today. I totally agree with sir. Second thing is, what I have seen in my experience in the last 5 years, just 5 years, people in the name of disruption, they're destroying healthcare, destructing healthcare in the name of destructions. The small aggregators, the startups, who will, in the name of, adding value, in the name of making profits, because they're all private equity funded and VC funded, end of the day, they need profits. To share a few examples with sir, I have many, but one example I'll share. A young man, 32-year-old man, he had a simple rectal bleeding, and he approached one of the aggregators in India, and they had a teleconsultation, and they gave some solutions to it. This man postponed for 2 long years to consult physically a doctor. Finally, he came to me. When I put my finger in the anal canal, it was CA rectum. So, in the name of digital health, in the name of aggregators, there is destruction happening in healthcare industry. There has to be a policy regulation on this. Otherwise, we will lead into very, very bad, grave consequences in this country. It is going to cost very, very badly. Sir, your answer on this, sir. Dr. Dorairaj Prabhakaran.
Thank you, sir, for pointing that out. I think you're pointing out the perils of unmitigated, unregulated telemedicine programs. But on the other hand, I think I completely agree with you that a doctor cannot be replaced, because the doctor's intellectual gravitas is required in terms of managing that patient. But digital tools can be your friend. I'll just give you two very small examples. A colleague of mine in Ludhiana is a cardiologist, has created a WhatsApp group across the world of cardiologists. All they do is when a patient comes, ECG is uploaded on that WhatsApp group and instant diagnosis is given. Because for us as cardiologists, time is muscle. You have to treat the patient or open the blocked artery within 1.5 hours, either by angioplasty or by clot busting, thrombolytic therapy. So that's a great example of a frugal technology, how it improves life, right? The second thing is we have created an interoperable telemedicine platform where a doctor sitting remotely can hear a cardiac sound, can hear the respiratory sound, can move the camera and see the patient, and actually you can train a community health worker. So it has to be a hybrid mode. It cannot be that a patient initiates a teleconsultation, goes to a doctor saying, this is my specialty. There's a lot of frustration because they go to the wrong specialty. So an assisted telemedicine has to be part of the solution. What I'm trying to say is that there has to be that physical component initially in terms of the diagnosis and the initial treatment, but subsequently in many of the chronic conditions, your post-operative patient, for example, at the end of 1 year, all you need to know is, did the patient have a recurrence? I mean, yours is an extreme example, but let's say it's a treatable condition. Hemorrhoids, for example, you want the patient to be followed up, patient can be followed up with a simple question. So those are some of the things. So I think we shouldn't throw the baby with the bathwater, as they say. We should look at a way of solving the problems that you have actually mentioned.
I will just add one small comment to that. The technology is not going to replace the doctors.
Correct.
Okay?
Right.
The doctors who use technology will replace the doctors who do not use it. This is eventually going to be there, but then doctors are going to be there. You cannot replace them. It's not possible.
We all are talking about digital health, right? An important part is that we are only focusing towards urban areas, right? Metros, big hospitals, big corporates and everything. But have we analyzed that in tier 2, tier 3 cities, the numbers and the volumes of hospitals, small hospital ranging from 35 beds to 50 beds to 100 beds, still they are lacking in implementing a simple basic HIS system. So how we are going to take digital health to that particular point? And for that, the major challenge with IT industry is the cost. And the areas where we are talking about the paying capacities of the people are in challenge. The hospitals which are there, they want to digitize, but the solutions what they want, they can't afford it. We all are talking about telemedicine, we are talking about digital health, we are talking about telemedicines or teleradiology, telepathology, everything is fantastic, fine, fabulous. But our 90% of populations around rural area is suffering. How we can use digital health to improve those qualities of care? I need to have answer for this.
I could give a 2-minute answer to that. Okay. There are solutions available in the market, and we have done some of those deployments also in the rural area as part of our Make Impact on the Ground activity, which do not really require the HIS system there. The solutions are simple: a neonatal care system for the newborn child, which is a problem in a majority of all those areas. Very simple system that allows doctor to do the monitoring remotely. And it does not need the hospital HIS system. It is simply there on the cloud, on the mobile application for the doctor, and that's it. There are other solutions also available which do not require HIS. They can be used, they have the cloud connectivity, and they can be simply used by the smartphone for the doctor. We can always talk about a whole lot of advanced requirements and everything which are there at tertiary care at the specialized hospitals and try to say that it has to be replicated everywhere. No, that approach is not going to work. But what I'm saying is that there are solutions which are available which can do quick digitization of the specific problems, specific areas in the remote and low resource areas. It is possible. It will not solve all the problems, I accept the point, but it is going to solve quite a few problems.
So maybe-
That's my simple answer.
Yeah, I'll just quickly add on. So, as you said, one is definitely affordability, right? Because you cannot buy those, and if you buy those, the cost of care goes up. But second, another bigger problem is also mindset shift. I think both plays together, right? And the doctor also has to, change. Like today, if you don't give a solution to the doctor through which he or she cannot complete the prescription in 10 seconds, then they'll say that my footfall, my overall productivity goes down. If I can write the prescription in 10 seconds on a paper, if I have to type it on an EHR, how I will be incentivized for this? So I think big answer to both of this is also incentive. So what is the incentive for the healthcare provider to shift to this new technology? And not only India, forget about India. In US also, which is far developed when compared to us, it's only high-tech. It took the high-tech act from the US government to incentivize the entire ecosystem to shift to the digital healthcare. And I think the same thing is happening now with ABHA, which if you look at, ABHA has also, National Health Authority has also released an incentive model. I think it just started, but I believe that will be going a long way in terms of driving adoption and also ensuring that due to this incentivization of hospitals in terms of LIS adoption, in terms of EHR adoption and all of that, I think that will solve it a bit. But it is going to be a journey. And as I said, it's affordability plus mind shift. I think those both things, incentive will play a key role.
I think we really need to be then moving out of the dais. So, but thanks to everyone, and thanks to all the panel members. I'm sure this is a discussion which can keep on going on because there are so many things which are all relevant to be spoken about. And thanks for being a very participating audience. Really thank you for all that. Thank you.